So coming back, before we jump off to the clinical trial side of it, do you think there are questions a patient should be asking, but they're not? Are there any of those that popping into your mind so you can share it with the public?
Yeah, I think, look, it's very important to make sure, and again, I'm a clinical trialist, so this is, the questions are, what treatment do you recommend that is available as far as standard of care? What is the state-of-the-art treatment with the best outcomes today? Right? And is that what you're recommending for me? And then two, what are the key clinical trials, right, in that space, whether it's in the adjuvant setting, neoadjuvant setting, and we have to talk about neoadjuvant, or in the metastatic setting, right? What are some of the key and most promising therapies that I might want to consider? And if you want to consider it, is it available, through you, or are there other institutions that I should go to for other opinions? I will say, so being at an academic center, there was a time when virtually a very high percentage of patients with advanced melanoma would go to big academic centers because they needed those clinical trials. Now we have effective immunotherapies. They can get treated closer to home. Huge benefit.
Huge benefit.
Huge benefit. But what that means is that it's becoming increasingly hard to answer some of these important questions about these new therapies, right?
Yeah, yeah.
And so I think access to trials is really important. I would definitely urge anyone going through this just to be a little bit aware of what
There is an option of clinical trial. So let's